need to see this. It's
something that'll change the world and human life as we know it.
When Monty talks, it's painful.
Monty, you have been so instrumental in kind of pointing me in the right direction.
It was about looking at your character defects in spirituality.
It's the integration of clinical practices with the 12 steps.
It's an absolute pleasure. He certainly knows a lot of people. He's got a lot of energy, and sometimes when you don't have so much energy, he picks you up and carries you.
Having the Monty man there certainly helps.
This is one of the places that is about the business of the solution.
The views expressed on this special broadcast of the Take 12 radio show do not necessarily reflect those of KHLT Recovery Broadcasting or its affiliates. KHLT is not affiliated with any particular 12-step fellowship.
Now here's that guy who's getting less popular minute by minute, your host, the Multi-Man.
Well, greetings, recovery family. Those of you in recovery, those of you who are advocates of, and perhaps some of you who should be, welcome to another fine episode here at Take12Radio.com on your internet dial, the world's only faith-based, recovery-focused, solution-focused radio station broadcasting 24 hours a day, 7 days a week, a different show every day of the week. Our email address here is take12radio@comcast.net. Hey, listen. We have an incredible start for this week's show. We have a couple of guests on right now that are down at the West Coast Symposium on Addictive Disorders down in La Quinta Resort in La Quinta, California. This is a symposium put on by C4 Recovery Solutions. And on the phone with me is 4-star General Berry McCaffrey, former White House Drug Czar, and also Dr. Phillip Herschman, the Chief Clinical Officer for the world's largest treatment provider, CRC Health Group. Gentlemen, welcome to the show.
Good to be with you, Monty. Thanks, Monty.
And thank you so much for taking the time out of your busy schedule to do this. I know that what's going on down there, it can be very hectic and really demanding. But some of the stuff that you guys are very passionate about that we wanted to hit on it has to do particularly with the opiate problem, the heroin problem, some of the new laws that have come down the pike. Let's start out talking about the treatment gap that's going on. Can you explain that to people?
Monty, this is General McCaffrey. Let me start, though, by telling you congratulations on 10 years of making a difference in recovery. Your work, your example, has made a huge difference in thousands of lives all over the country, and we're grateful for it, those of us who are worried about the 22 million of us who have a chronic substance abuse problem. Thanks for your work.
Well, God bless you, man. Thank you so much for those kind words. It means a great deal. We certainly don't do this by ourselves. We've got a mighty and loving God that's behind it all, and a whole bunch of people that are supportive like you guys. Thank you for your work as well.
Well, look, let me. I think you had a whole series of questions. Dr. Herschman and I are going to provide a presentation tonight for a couple hours to 750 or more clinical specialists from across the country, nurses, doctors, at the Western Addiction Symposium here in La Quinta. So it's a tremendous opportunity for us to talk. And, CRC Health Group has 140 some odd treatment centers all across the country. On a given day, we got probably 35,000 people in treatment. So it's a good opportunity for Dr. Herschman and I to talk about evidence-based practices and how we get people to achieve and maintain sobriety. So we're very proud to be part of this symposium.
And what time do you do that tonight, so the listeners know that might be in the area?
Well, we're on from 7 to 9 p.m. Here in the resort, and people are coming in. So we're sort of the opening presentation. And then they've got several days of absolutely fascinating seminars by specialists from across I think 36 some odd states from across the western half of the country will be here.
Right, right. Well, congratulations. I'm so glad that you're opening this thing. It is so needed, and people need to understand really we can't understand the solution unless we understand the problem, and vice versa. True?
Yeah, exactly.
Yeah, yeah. So, okay. So, again, 23 million, we've got a treatment gap. What's that about?
Well, I want Dr. Herschman to talk about how we actually deal with the chronic addicts. But, one of our big social policy problems, most of us are drug-free. Most of us, even those who use alcohol, don't encounter a problem. But maybe 22 million do. And, we've only got 3+ million people get access to drug treatment in a given year. So if it wasn't for the magic of AA and NA, if it wasn't for the 3,000 drug courts all across this country where the judicial system trying to keep people diverted out of prison and into treatment, we'd be in real trouble. So that's a policy challenge, and at state level and county level and the national government, we got to address it.
Before we go to Dr. Herschman, let me ask you. You mentioned something. We did a show on this a couple of weeks ago, and I'm a real advocate of it. You said the statement drug courts. That's really being successful, isn't it?
Oh, we are thrilled. This is the 25th anniversary. We were all in Miami last month and had hundreds of drug courts on streaming video watching the birthday celebration. We just opened the conference this morning in Anaheim, more than 5,000 people there. And then probably the most important part of the opening ceremony, went on for 3 hours, was we had a parade of transformation. So we had a series of about 10 speakers get up there and talk about how they gained sobriety, ended up in recovery because they got arrested, they surrendered their life, they realized they had no way out, and it worked. And by the way, this program, spend $7,000 on a drug court participant or spend $45,000 locking them up for the same year. And the results are just unbelievable. So up come successful lawyers, government officials, you name it, people are now in recovery because of the drug court system. So it's very gratifying to see this. Basically, a lot of these people that appear in front of a drug court, arrested on Saturday night, their lives are in total chaos, and then they suddenly encounter the first person in their life, in many cases, who has both authority and who loves them. And that's the secret to the drug court. We add treatment to that envelope.
Wonderful. Absolutely wonderful. Well, Dr. Herschman, thank you for taking the time to come on as well. Can we talk about treatment for a minute and what CRC does and what's this treatment gap problem?
Sure. First, let me add my congratulations to what General McCaffrey said. 10 years of carrying a recovery message to your reach, I think that's outstanding, and I wish there were more folks out there that had your commitment to helping this population. So good for you.
Thank you. Thank you so much.
So I think treatment is starting to go through a pretty big change that will be driven a lot now by healthcare reform. And I think the biggest change is greater acceptance of the disease as a chronic disease, something that you would treat more akin to diabetes or hypertension than a broken leg where you go in for an episode of care and then get fixed and you're done. With substance use disorders, it's chronic. We need to continue to help patients stay in treatment and manage their disease. And I think that's part of the recovery message, whether it be through a self-help group and or other kinds of providers. But I think that switch to viewing and treating substance use disorders as a chronic disease will be a big shift going forward.
Okay, so this brings me to the question of parity. Folks are understanding more and more that, if you have cancer and you're in the hospital and your cancer comes back, it's arrested, but then it comes back, they don't kick you out of the hospital. why is there such an issue? Why do we have to have these parity laws, and how are we going to enforce them?
Great question, and there's two or three parts to it. I think parity was a great start. It said if you provide a mental health or substance abuse benefit, it must be on par with the physical medicine benefit. It did not, however, mandate that you provide a mental health or substance abuse benefit. Healthcare reform is a nice package with parity because healthcare reform does mandate a substance abuse mental health benefit. So between the two, we've got a benefit and it's on par with a medical problem. That's terrific, and that's a great start, and way too long in coming, quite frankly. The other part of that is, despite the regulations and obviously our attempts to make sure they're implemented appropriately, is that there's too much misthinking out there about the disease, and even I think in the treatment community, there's too much of the old school treatment. To your point, that says, if you're in treatment but you show a symptom of your treatment, we're going to kick you out. I mean, that doesn't happen. When I have hypertension, when my blood pressure goes up, my doctor doesn't keep me out of treatment. He finds a better way to treat me. And I think we have to get more and more of that mindset.
Yeah, we sure do. It doesn't make any sense. But do you think people are gonna fall in line with this thing and actually respect this law and obey it, or do you think we got a battle ahead of us?
I think there's going to be a battle. I mean, I think almost if you look back in time, any time there's major change, major legislative change, you typically have to wind up in the courts to make sure it's implemented appropriately. So it won't surprise me if we don't have to wind up in the courts to make sure that parity and the appropriate parts of healthcare reform are implemented the way they were intended.
Sure. Well, and in the meantime, people die, and that's the sad truth of it many times. Let's talk about opiates and heroin for a minute. We have seen such a huge increase in prescription drug abuse, particularly in the area of opiates, and now because of the street cost of those pills and other methods, we've seen an increase back to heroin, right?
That's exactly right. That was well said, because there was the abuse of prescription opiates like OxyContin that was growing dramatically year over year, and then there started to be a lot more oversight on the physicians who were prescribing those opiates, and a lot more in the press, in general public, about the abuse of it. So fewer of those opiates became available. Well, heroin's always out there, so heroin became a lot cheaper than the prescription opiate, and that's what's behind its current rise.
I might add, Monty, something that you would totally agree with. Over time, over the years, we've had a huge decrease in the amount of methamphetamine addiction going around, a huge decrease in crack cocaine. But I think we ought to argue that we don't care what your drug of choice is. And by the way, most of it's polydrug abuse, which always includes the devastating drug of alcohol. We care about you living a drug-dazed, unemployed, encounters with the judicial system, in and out of emergency rooms for medical care. That's what we care about. So we want to make sure that that's the message. And by the way, so a lot of that depends on prevention and education. Are your parents, are your homeroom teachers, your coaches, your pediatrician articulating a message that in this family, in this school, in this team, we're not using drugs? That will the front end is the easiest place to get at the issue. But now if you're addicted, for God's sakes, we spend $800 million a year in the National Institute of Health on understanding how to treat drug addiction. We actually, your listeners know this, can get people into treatment. We can detoxify them. We can, try and teach them the cognitive skills they need to understand their disease. And then when they relapse, as Dr. Herschman said, for God's sakes, if your grandmother has cancer, you don't give her one shot at it. You have a continuum of care. So I'm sort of optimistic, to be honest. I think this country is moving in the right direction. And shows like yours, Monty, are helping us.
Well, I certainly hope so. And I'm optimistic, too. And I think we all have to remember that sometimes things appear like they're going backwards, and we need not be discouraged. We need not to give up. We need to keep pressing forward. And you guys are really on the front lines of this thing. Let me ask you both this question. There's two entities within the 12-step community that have been criticized for a long time. One is the faith community, the church. The other is treatment facilities. And it's interesting to me because both the faith community and treatment facilities are some of the 12-steppers' biggest advocates. What do you think? Why is it them against us, and is that getting better?
Yeah, let me throw in a thought of that. Early on in my education on how drug treatment works, and I was 1996 National Drug Policy Director. I went up to a wonderful drug treatment clinic. They have places across the country. It's a nonprofit. And at the end of it, because I knew something about AA, I said, to what extent is there a spiritual component to this program? And the director, with his MD, PhD, said, well, in this clinic, it's spiritual with a small s. So at one point, I was going to write a book that said, drug and alcohol treatment with a large S, because I think you do need family engagement and friends and employers and the whole notion of it.
Yeah.
Your life is helpless. You got to give it up and look to a higher power. So now the other problem, though, we got to face up to is thank God for the science community who has given us methadone, buprenorphine, Vivitrol. There's a series of drugs coming down out of the research community to deal with cocaine addiction. There is no magic pill on addiction. However, if we're going to deal with an opiate condition, using some of these drugs in concert with counseling, in concert with 12 steps, in concert with reaching out to a higher power, that's the way you gain sobriety.
I think let me build on that, because I think that's an incredibly important concept. The notion of either or is never right.
Right.
And the disease is such that the best treatment involves a very individualized set of interventions for a given patient. And every alternative should be available, and it's our job as treating professionals to help the patient identify what the most effective interventions are going to be for him at this point in the course of his disease.
Very well said. Very, very well said. Well, gentlemen, we are out of time. I know you guys got to get back to the symposium. Thank you so much. Any last words you'd like to share with our listeners?
Monty, happy 10-year anniversary.
Thank you, my friend. And
don't sign that and tell your audience anytime they're looking for it, they feel like they need help, don't hesitate to look out for help.
Absolutely. You bet. Thank you so much for that. You guys are great. Keep doing what you're doing. We look forward to hearing more great stuff from you, and give our best to the folks from C4 and the West Coast Symposium on Addictive Disorders. By the way, folks, being held right now at the La Quinta Resort in La Quinta, California through Sunday. And you can stop by there, shake somebody's hand, say hello. It doesn't cost anything to walk in and just visit. Some wonderful people at the West Coast Symposium this year. Thank you, guys.
All right. Thanks, Mike.
All right. Well, by the way, and I want to say really, really fast, I want to thank Bob Weiner, the president of Robert Weiner Associates News in Washington. You can visit his website at weinerpublic.com. If it wasn't for him, we wouldn't have had this thing set up when we've talked to you guys. We've talked to General McCaffrey before. On now. Thank you so much, Bob, for the work you do. It's marvelous, my friend.
Thanks, Monty, for what you do. It's a shared team effort.
All right. Folks, don't go away. We'll be right back. When it comes to drug and alcohol treatment, all of us here at Take 12 Radio understand how overwhelming it is to find the right facility for you and your loved one. The internet alone is flooded with drug and alcohol treatment centers claiming to be the one that can help achieve a life of abundance free from addiction. How can one possibly know which one to choose? Well, when you call Broad Highway Recovery for a drug and alcohol treatment referral, you will immediately know that the person who answers the phone is very passionate about making sure they recommend the best facility for the individual that's in need. They will narrow your search down to 3 drug rehab facilities based on the information that you provide. Each call is confidential, and each caller will be treated with the utmost respect and compassion. Look, you don't have to go through this alone. The folks at Broad Highway are interventionists that are 100% committed to helping your family. If you are willing to go to any length for your loved one, then they can help you begin the recovery process. Please call them today and take the first step towards a new and bright future on the broad highway of recovery from alcohol and drug addiction. Their toll-free number is 877-487-1599. That's 877-487-1599. Visit their website at broadhighwayrecovery.com.
Origins Recovery Centers provides integrated inpatient treatment for substance abuse and co-occurring disorders. At Origins, clients receive expert medical, clinical, and spiritual care individually designed for their needs. Our clients leave Origins with a foundation upon which they will build the rest of their lives. Call now to speak with an admissions specialist. Our toll-free number is 888-843-8935. That's 888-843-8935. Origins, delivering real solutions for real families.
I feel the earth move.
All right. The earth is moving under our feet. Thank you, Carole King. That's from her Tapestry album. Hey, listen, our email address is take12radio@comcast.net. Don't forget the Recovery Cartoon Caption Contest. Still in full swing for May. And if you just click on Recovery Cartoons at take12radio.com on your internet dial, you will see a cartoon that has no caption. That's where you come in, you decide what it should say, enter it in the submit box with your email address, click on submit, and you could win a recovery DVD and bonus CD from Mark Lundholm, recovery comedian, Addiction, a comedy of substance, along with his CD, How Is That Funny? All right. We talked quite a bit about the problem of addiction, particularly the explosion of heroin abuse and opiate abuse today in the country, and we talked about parity. We talked about what parity. For those of you who don't know what parity means, a real simplistic way to put that is you cannot. It's illegal. It's against the law to treat an addict or an alcoholic any different than somebody who has cancer, who has diabetes. In other words, I'll give you an example. If you have cancer and you're in the hospital and it's been arrested and it comes back, they don't kick you out of the hospital. They treat you. If you are an addict and you have been clean and sober and you get sick because you relapse, they don't kick you out of the hospital. They don't say you can't be there. They treat you. They cannot treat you any differently, depending on, from one illness to the other. They have to treat you. That's a real simplistic way of putting parity. And it involves treatment facilities, insurance companies, and all sorts of things. So that's some of the stuff that 4-star General Berry McCaffrey, former White House drug czar, and by the way, drug czar for the White House doesn't mean that he buys drugs for the White House. I know drug czar sounds kind of like that, but that's not what it is. And Dr. Phillip Herschman, the Chief Clinical Officer for the largest treatment provider in the world, CRC Health Group, were our guest for the first half of the show. Okay, so we talked about the problem. Let's talk about the solution. I mean, we don't want to give you a big mess without showing you that recovery works, that this stuff actually is effective and a person can recover from a seemingly hopeless state of mind and body. So in the studio with me right now is a gentleman that I'm biased. He's my godson. He is somebody I've known since he was a little tyke. This is Tony Pollard, and he has celebrated 3 years being substance-free from alcohol and methamphetamine, as well as some other mood-mind-altering substances. He's been in recovery and doing the deal. And just here a few weeks ago, he celebrated 3 years, and I had the honor earlier today of giving him his 3-year coin from another fellowship. Tony, welcome.
Thank you, Ronnie. I feel blessed to be here.
So this is the first time you've ever done a radio gig, right?
Absolutely.
So it's okay. What was going on, man? I mean, you didn't wake up one morning saying, I'm going to put a needle in my arm and a bottle in my mouth.
Actually, the needle was that was out of the question. I told myself I'd never use a needle, and I've used needles. I never said that. I never said, I just want to be a junkie. Nobody ever says that. It happens, and
So what was going on? I mean, you really had a difficult time growing up.
Yeah. As a kid, I experienced the high of marijuana. It was openly smoked inside my home. It was openly given to us kids, and we were told it was like medicine. And it didn't do what the people at DARE said it would do. And so I just continued to smoke marijuana, and I drank earlier than the age of 21, and it progressed from there. I was separated from the place where I've always lived, and after my parents got a divorce, and I was taken up to Portland, and that's where some heavier drugs got introduced into my life, and at that point I had lost all hope because I had been taken away from the friends and family that I had loved, and what was familiar to me, and I'd been taken and placed in a completely different environment, told to thrive. And I was just a kid. I may have been 16 or 15 to 16, somewhere in there,
Right.
I got clouded memory, but I was still a kid. Drugs were the only way I'd been taught or learned how to cope with anything that was uncomfortable.
So if something didn't feel good, medicate.
Absolutely. The saying, "The family that prays together stays together."
Yeah.
There was some of my friends made a joke one day, and they say, "Your family is the family that tokes together, chokes together."
Wow.
And and I kind of laughed about it, and I'm like, "Oh yeah, that's funny, ha ha ha." But it was only a short time after that I realized how true that really was.
Now you were in a family that, for all intents and purposes, knew who God was,
Absolutely.
had experienced a relationship with God at in some intervals, some healthy relationship with God, in and out.
Right.
You had gone to church camp. You had done, you gotten involved with that for a while. I remember when you were thriving in that.
Absolutely.
But everybody else around you was falling apart. There are people that listen to this show that still don't get it. You can love God. You can understand the relationship with Him. It can be a spiritual relationship, and you can still end up being an active addict.
Well, absolutely. Just like you can love God and you can know God, but you can still have a cold.
Right.
And just like you can still be an addict and love God. That's one way that that I've been able to relate it in my head is, it's just like any other sickness.
And yet some would say, oh, no, that's a choice. That's a choice. You made a choice. But did you? I mean, did you wake up saying, this is what I'm going to do in my life?
No, I did not make that decision. And those people that say those things, I'm happy for them that they don't have to struggle with drugs and alcohol and the things of that sort. But they also don't know what it's like to have something that controls you and that drives your every thought and every movement through the day. It's the definition of insanity. It's doing the same thing over and over and over again, expecting a different result.
And you did that for a long time?
About 13 to 15 years of my life.
Right.
Yeah.
What some people probably don't know, but they're going to know here in a minute, is I was your first sponsor.
Absolutely.
Yeah. But you weren't done yet.
I wasn't ready to address some issues in my life. No.
And yet I remember you weren't here anymore. You were out doing whatever you were doing, and we had seen you on the street a couple times, and you waved and we honked, and we wanted so bad to stop, but we knew God was saying, no, don't do that. Because if you do, you might get in my way.
Right.
And so we would pray and then you got a year clean and sober and you called me.
Yeah.
And you said, Monty, I got a year. I'll never forget that. And then you got 2 years and you called me.
Yeah.
And then you got 3 years just here a few days ago and you called me.
Yeah.
And this is the first time you and I have seen each other since you first started really getting well.
I didn't want anybody that I cared about to see me hurting myself, because I know that would have hurt them. And I know that by not seeing me, that also hurt them. But I just figured by me keeping myself away, that was the lesser of two evils. And
that's what you knew. It's part of your survival mechanism. It's what you knew.
So I reclused for a while.
Yeah.
I put myself into a treatment facility, and I had a couple of relapses there in between, and and I'm not healed. I won't ever be healed, but I'm sober today by the grace of God.
Yeah.
Through the programs that I attend regularly, and and the people that are involved in my life that love me and accept me for me. And that's what it's all about, is having people you can rely on and you can go to and say, you know what, I'm having a tough time. Having people you can talk to and just be brutally honest with, and whatever you say isn't going to affect your friendship, your relationship with them, or anything like that. You need those people, those accountability partners, to just bounce things off of. And some of them are good to just listen, and some of them you need some talk back from. You need them to give you a little piece of their mind, and then you need sponsors too. Everybody needs a sponsor. If you don't have one, I recommend you get a sponsor. And the sponsor is the guy who he pounds on your door when you don't show up to a meeting, and he says, "Where were you?"
Hold you accountable.
Yeah, absolutely. And he walks you through the steps. He walks with you. I've had a couple of sponsors, and it takes a really, really strong person to be a sponsor, and as well as an accountability partner.
If they're going to be an effective sponsor, because they have to hold you to the fire.
Right.
Yeah.
And they have to have done the steps themselves.
Yeah.
You cannot be a sponsor if you haven't done the steps yourself.
Now you can be of service.
Absolutely.
You can contribute to other people's recovery. You can do, but if you're trying to sponsor somebody and teach them something that you haven't learned yet,
right?
Well, good luck with that.
Right. If you're a sponsor to somebody who's on step 4 and you haven't completed step 4, then it's not going to work.
Right.
You're just hindering that person and yourself.
Yeah.
Because you're not able to focus as much on your recovery, and that person, their recovery is going to be hindered because you don't have what they need.
Yeah. So let me ask you: have you worked with anybody yet?
I have. Yeah.
Was that heartbreaking? Successful? How'd it go?
It's not an easy process. I'm not here to sugarcoat anything. The first 3 steps, they came pretty easy. And once I hit the 4th step, doing your inventory and all that's tough. Nobody wants to face the nasty things they've done or the things they haven't done.
Good point.
For whatever reason. even if you're not an addict or an alcoholic and you're just a codependent, or you're just a workaholic, or whatever your addiction is, or your hurt, habit, or hang-up, you need to address step 4 slowly and carefully with a sponsor.
Thoroughly.
Yes, absolutely. Because if you don't, you might be able to just move right on to step 5, but somewhere down the line, you're going to hit a brick wall and you're going to go backwards. And you're going to have to go back to right before step 4, and until you do step 4, that's where you're going to keep running into that wall.
It's interesting because after step 5, I believe it says in the Big Book of Alcoholics Anonymous, it says we take some time alone and we think very careful. I'm paraphrasing now. We think very carefully, have we left anything out?
Absolutely.
Because our tendency is to do that unintentionally. Sometimes things are too painful to even address, and God gives us a mechanism to protect us. And maybe it may not be time to look at that, but at some point we have to be willing to look at all of it. And so we have to say, okay. And I know for me, when I did my 5th step, which was very healing and very therapeutic, I was ready after that to look at some things I had missed, and I had to go back, and do that. Have you found in working with other people that there is a place where some people just stop?
Where I see people stop is usually right at step 4. And if they stop at step 4 and they say, well, I can't do this, all I can say is, well, then maybe you're not ready to go through this completely.
Maybe they haven't understood step 1.
Right.
Yeah.
And that's exactly what I tell them. Go back to step 1. Because if you're not ready to do step 4, you haven't completely done step 1 through 3.
Yeah, good point. Good point. We have to have the desperation of a drowning man.
Absolutely.
And if we don't have that...
And just like I was telling you a little bit earlier, if you can't swim, you can't save that other person drowning.
Yeah.
So
you'll just take them down.
Right.
With you. Okay, we're going to take a break, and when we come back, let's talk about what is behind Tony's sobriety. What's really going on? Is there power in the meetings and the people and the steps? And if not, where is that power? Who is that power? And who is really behind the solution in this thing? Folks, don't go away. We'll be right back after this. Serenity Springs Recovery Center, located on the beautiful east coast of Florida. A unique facility that is committed to providing exceptional individual care in small group settings while utilizing their experienced and dedicated clinical and support staff of licensed therapists and doctors. Visit their website, serenityspringsrecovery.com, or call 386-423-4540. Serenity Springs, making a life-changing investment into your recovery.
Men, women, and their families experience tremendous pain and suffering due to the struggles they face from substance abuse and its co-occurring mental health challenges. They need to find a safe place for peace and healing. Therapia Addiction Healing Center was born out of a deep desire to provide that safe and powerful healing environment. Therapia exists to help people recover from addictions by developing and maintaining healthy, meaningful relationships with God, self, and others. To speak with an addiction specialist, call 1-855-652-4325. That's 1-855-652-4325. Or visit our website at www.therapia.net. Therapia Addiction Healing Center, restoring lives one step at a time.
I come in last night about 10:30. That baby of mine wouldn't let me in. So move it on.
Georgie boy. Georgie Thorogood. And moving on over, everybody. Move it on over, you drug addicts, you. We do have to get out of the way, let God do his thing. And, and that's what happened in Tony's life. Tony Pollard is my guest, the second half of the show here at Take12Radio.com. And, okay. So you knew and had a relationship with God before, you got into recovery.
Absolutely.
But something changed in this process, this step process, the accountability process, the fellowship that you're now involved in. And by the way, you do service work in several aspects in that fellowship. So what changed? People are going, well, what's different? I mean, he already had a relationship with God. What changed? And how did that change? What did the steps do for you that just coming to God and saying, I am yours, God, didn't do?
Well, the first part is admitting that you are powerless. And a lot of people aren't willing to do that.
Mm-hmm.
They like to, because once you admit you're powerless, that's giving up your control.
Mm.
And as addicts, we're all control freaks.
Mm-hmm.
I didn't want to give up any control because things that happened to me when I was a kid, I didn't have a control over that. Things that happened in my life otherwise, I haven't had control.
Right.
And all I had control over was my addictions. I didn't want to give up that control. So actually having to give up, render control to God, to my higher power, was the biggest part that started me on the process of recovery.
Okay, and so that wasn't something we're necessarily taught when somebody says, well, take my hand, let's go to the altar and give your life to Jesus.
Right.
We're kind of then left to our own devices. If there's no discipleship, no guidance, no mentoring, what do you do? And if you're coming home after church camp and your parents are smoking pot and drinking and saying, here, take a hit, your chances of growing in a relationship with God are probably going to be a little slim. Did you have a white light experience? Was it very quiet? Did something, we know Bill W., the co-founder of Alcoholics Anonymous, had a white light experience. Not everybody has that. What happened to you? What can you pinpoint or not?
Well,
the day something clicked. I mean, to tell you the truth, I can't give you the date and time. I just know it did. Can you?
I can't give you a date, but I can tell you that the time that it happened. And I didn't even, I used after that time, but I knew that I wanted sobriety from that point on.
Mm-hmm.
I have hydrocephalus, which is a condition where the cerebral spinal fluid around your brain that protects it doesn't drain properly. And so mine was suffocating my brain. I collapsed one day and was rushed up to OHSU. I was informed that I needed to have emergency surgery, and I had my surgery, and the doctor came in and he said, we found all kinds of illegal drugs in your system. You got to quit. It's your life. And so I went home and I quit doing the hard drugs, I thought, marijuana's not a drug, it's medicine.
Because that's what you were told.
That's what I've been taught.
Yeah.
So, I continue to smoke marijuana and drink, but only on days that ended in Y. And if there were any others, I would have done it then too. But,
right.
Shortly after that, a couple months maybe, I had another spell, so to speak, and I had to be rushed up to OHSU again. And this time, the ventricles that they had opened up so my brain could have some relief had closed up again.
Mm.
And so they put a Strata 2 programmable shunt catheter into my brain to drain the fluid off of my brain. And that same neurosurgeon came into my room and he said, young man, this is twice you've escaped death. And I found the same drugs in your system that I found before. He goes, there will not be a third time. He goes, you are tempting God, and he doesn't like that.
Wow.
And
in your face.
Yeah.
Antonio.
He was pretty blunt about it. So I went home. I didn't know how to quit.
Mm-hmm.
I continued to live with my mother. I lost the ability to walk, but up until the surgery, and I was walking again, and I was walking by at one of my neighbor's houses, and he has a 1973 blue and white Thunderbird, and I fell in love with this car from the day I saw it, and he just happened to be outside, and I go, hey, I love your car. And that struck up a conversation, and I lied a little bit. I told him I was in recovery. I fed him quite the line of BS, and
right.
He goes, okay, well then you want to go to a meeting with me tonight? And I go, well, and I couldn't think of a quick enough excuse, and I said, sure, why not? So I went to a meeting with him, and within another month, I had moved in with him because I knew that I couldn't stay sober living in a house where everybody was smoking weed and drinking. And he said, I've got an open room here, and you're more than welcome to stay here if you're going to work on staying sober. And so I moved in with him, and that was almost 4 years ago. I didn't stay clean the entire time, but as of about a week or so ago, I have 3 years clean, and
wow.
I know that God put Lance in my life to save my life.
Mm-hmm. When the student is ready, the teacher will appear. Right?
Absolutely.
Yeah.
Absolutely.
Yeah.
I know that all those times when I was in those dark alleys or in the scary places, getting my fix, sticking a needle in my body, and I was thinking to myself, where are you, God?
Mm-hmm.
He was always there, reaching down.
Yeah.
He was just waiting for me to reach up.
Mm.
And so, it's possible. You just got to ask for it and be willing to do your part.
It is obvious that this moves you.
Yes.
For more than just one reason. Not just your own life has been saved, but you are currently watching, really, with few exceptions, your entire family walking down the road where the dragon is.
Yeah.
And prayer is powerful.
Absolutely.
And you can do that. But other than that, you're kind of left to sit back and trust God, right?
Right.
And that's really tough.
Yeah, it is.
Because it's your mom, your brothers, your stepdad. I mean, it's real ugly.
Yeah. I know that there's nothing that I can do besides pray and have faith that God will one day relieve my family from the bondage of drugs.
It's okay, man.
Sometimes I get pretty angry with God. I get impatient.
And he gets that.
But that's usually when he throws me a bone, so to speak. A glimmer of hope.
Yeah.
Yeah. And about 7 months ago, I got a pretty big glimmer of hope. And that's my baby nephew.
Mm-hmm.
He was brought into this world, and man, that little kid, he's innocent. So I just pray every day that my little sister will soon take a look at that little baby and snap out of it.
Yeah.
And it'll become a chain reaction with my family. And I know that it's not in our time. It's in God's time. And that's frustrating sometimes, too.
Yeah,
but,
I know.
Yeah.
But see, you started the chain reaction. You started the domino effect. It started. Did you ever think in a million years that would start with you?
Well, I never thought ever that I'd ever even have a day of sobriety.
Yeah.
I never, to be perfectly honest, I don't think I wanted a day of sobriety.
Right. I get that. So you didn't come to God because you decided, well, I'm just going to do the right thing. He drew you to Him.
Absolutely.
Yeah.
Left to our own devices, we're all just a mess.
Right.
We're all that pile of trash on the corner that everybody passes by, but God sees that pile of trash as a treasure, something not to be thrown away, but to be salvaged and saved.
Right. And let's get real specific here, because this is not we're not affiliated with AA, we're not affiliated with NA, this radio show, we're not affiliated with Alcoholics Victorious, we're not affiliated with Celebrate Recovery Life, we're not affiliated with any of those. We are our own entity, so we can say what we want to say here. If people are offended, they can turn us off if they want to. We're not saying this in an inappropriate setting where it may not be appropriate to say it. We're saying it on Take 12 Radio.
Right.
And I want listeners to know that this is a issue that we dance around in our 12-step fellowships, faith-based and otherwise, many times. But I will not dance around it at Take 12 Radio. The God that Ebby Thatcher was talking about to Bill Wilson, he said very clearly. He made it very clear, and Bill talks about it in Bill's story, that he had a real bad attitude towards religious topics, and that he was wrong, and he had to change his thinking. And Ebby told him about who this God was. It says on page 11 in the Big Book of Alcoholics Anonymous, it says, to Jesus, or to Christ, I considered a good man, not too closely followed by, his followers and so forth. But that's it. I wasn't going to talk about it anymore. Well, who were they talking about? They were talking about Christ. Otherwise, he wouldn't have said that.
Absolutely.
Okay, so yeah, the only requirement for membership in any of these 12-step programs that are your mainline ones is the desire to stop whatever it is you're doing. Nobody's saying you have to agree with this, but it does say what it says. And in your case, and in my case, and in many people's cases, we ended up having our higher power coming into our lives. It was the same higher power that came into Bill Wilson's life, Dr. Bob's life, Ebby Thatcher's life, and many of the first people that stayed sober in the original 12-step fellowship. So I'm like, if it was good enough for them, it's good enough for me.
Right.
Now, people listening, you don't have to agree with me. That's okay. I'm not saying you do. But our experience has been, this was who, Tony?
Jesus Christ.
Yeah. And that is something that nobody can take away from you.
Absolutely not.
Right. Yeah, it's powerful stuff.
Yeah.
and I'm so grateful. I'm so grateful because I have seen where you were. I was where you were. And someday when I have enough time, I may tell the story about how your dad, who is currently active in his addiction and dying from other complications, illnesses, was a part of saving my life and was there on the last day that I ever took a drink, almost 17 years ago. God is a good God. God is bigger than our issues, isn't he?
God is great.
Yeah, God is great. God is great. And so we don't pull any punches. We don't, not every show at Take 12 Radio do we get this specific. We get that. We want to be all inclusive. We don't want people to be offended or scared away. But when we're talking about a person's personal experience, we need to tell the truth and not be afraid to talk about it.
Absolutely.
Yeah.
God is awesome.
You know how good it is to see you smile like this, man, after several years back the last time I saw you, you were just so miserable.
Yeah. Well, I was a point in my life to where I didn't know, honestly, whether I wanted to go on living. Drugs and alcohol had stolen so much from me, but yet I was still, so to speak, worshiping them.
Right.
I was chasing them like they were a lost dog that I had had from a child.
Mm.
And I feel so much lighter not having that drive to just like wake up in the morning and where am I going to get my next fix? You know, how am I going to get it?
Right. And that's where the obsession's been removed, right?
Absolutely.
Yeah.
Absolutely. Yeah. And I feel 1,000 times lighter.
Well, Tony, we are out of time. Thank you, brother.
You're welcome. Thank you, Monty.
Yeah, this has been awesome, man. What fun this is. Folks, if you want to write us, if you want to comment on Tony's story, please email us here at take12radio@comcast.net. If you can't remember that, just go to the website, take12radio.com, click on the contacts link, and listen. Play the show again, burn a copy of the show. You have our permission to do that. If you would like a copy, just notify us and we'll make sure we can get one to you. And you can check this out on YouTube, our play button, or download MP3. There's all sorts of ways to do it on our social networking sites as well. Well, special thanks to Tony Pollard, my good friend, my godson, my buddy, my comrade in recovery. God bless you, buddy. Thank you so
Monty.
much.
I love you.
I love you too, man. I love you too. And special thanks to 4-star General Berry McCaffrey, former White House Drug Czar, and Dr. Phillip Herschman, the Chief Clinical Officer for the CRC Health Group. They are speaking right now as we speak at the West Coast Symposium on Addictive Disorders, hosted by C4 Recovery Solutions in La Quinta Resort at La Quinta, California. Through Sunday. This interview will be up all week long, and then it'll be in our archives page, so you can go back there and listen to it as well. A special thanks to Bob Weiner, who is the president of Robert Weiner Associate News of Washington, and his work that he does to enable us to interview folks like General Berry McCaffrey and Dr. Phillip Herschman. He does tremendous work. Thank you, Bob, so much for your participation and our partnership here with you at Take 12 Radio. All right, until our next broadcast, my friends, this is the Monty Man along with Tony, and we're wishing God's perfect serenity for you. Bye-bye now.
This has been a broadcast of KHLT Recovery Broadcasting.
Kitty, 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 kitty.